I'm here to talk about some of the work I've been doing on the issue of molecular HIV surveillance or genomic surveillance or cluster detection and response, as they call it in the US. And some of the work that community have been doing and some of the work that we've been doing as activist academics around this issue to call attention to some of the ethical concerns that this raises. Because we're really behind and I'm going to try and kind of rush through some of the big issues, I just want to highlight a few of the papers that you could check out that we have published on this issue, where you can get more information about the context of what I'm talking about today. So one of them was published a couple of years ago in Critical Public Health, looking at the implications for consent and criminalization in relation to this issue. And another one we published as the guest editor issue for the American Journal of Bioethics special issue on this was a group of people living with HIV who are, and some activists and academics who are working on a kind of a molecular surveillance working group that we've been working across North America on this issue. And we responded to some of the issues in relation to the ethics of molecular HIV surveillance. But to go back first, I just wanted to say that some molecular surveillance proponents have said that they focus on the data they study is about molecules and not people. And the work that we've been really trying to focus on is that molecules are connected to people, they're part of our bodies, and people are connected to social contexts. And in Canada, the social context is that we are a leading country in the world for criminalizing HIV and people living with HIV. And we need to be very aware about how data can be shared and weaponized to target people living with HIV. So data is not benign, and we have to be just very wary about how data can be weaponized. And I want to highlight, and I think Francois did a great job of this, and I really appreciated it, that this issue is highly contested and being actively debated around the world. Not so much in Canada, so I'm hoping today we can spark a little bit of discussion about this, because in the US, there's a very active contestation about the practice happening, and I'll get into a little bit about that. But specifically, there has been demonstrations against the CDC in relation to the rollout of cluster detection and response. There was calls for a moratorium by people living with HIV on the practice of molecular HIV surveillance. That call for a moratorium actually halted a number of NIH-funded studies, one specifically in Washington State, where the researchers listened to people living with HIV about our concerns in relation to using data without our consent, and they stopped the study and have actually reflected on community engagement. So I would just call on researchers who are interested in this to consider that approach. And also, there was a recent resolution from the President's Advisory Committee on HIV and AIDS that has called for the CDC to roll out opt-out processes for people living with HIV and forms of dynamic consent for when they collect information and use it for secondary purposes. But this is an issue that connects directly to HIV criminalization, connects directly to our bodily autonomy and our rights to privacy and consent. So just highlighting the importance of this issue. This is a picture of which we got the title of our article for in the American Journal of Bioethics, when there was a demonstration against the head of the CDC in the US calling for the acknowledgement that we are people, not clusters, and that we need to be understood in that regard, bringing a people-centered approach back into understanding this research. And so I think Francois did a good job of kind of highlighting how this research works, but just to highlight again that molecular HIV surveillance starts with our blood tests, as you all know. Sorry, there's nowhere to put this. And often the blood that is taken from us and used for this is taken in a clinical setting and then is repurposed, often without our consent or knowledge, by public health authorities for surveillance purposes. And public health authorities use this research to identify clusters where rates of infection are happening at a higher rate than other aspects of the population. To be meaningful, this genetic information must be linked to a whole range of other demographic information that is also collected, which can include age, race, sex assigned at birth, migration or citizenship status, drug use history, sex work history, sexual practices, anything that people share in clinical encounters. This is all linked together. Genetic information on its own is not so interesting unless it's connected to all of this other stuff. And that's where some of the concerns come into play. It's also important to highlight, often in the way that this data is talked about by researchers, is that it is anonymized. And that is not identifiable, but this is a unique genetic makeup of people's blood, the virus in people's blood. This is a fingerprint, it is identifiable. Some of the things that can be determined using genetic research or genetic research and surveillance is medication resistance. That's actually the technology that has allowed for this to happen. And because it's become cheaper to do, this is rolled out really in lots of places as a result of it's kind of cheaper and more effective to do. But the general aim initially was to determine medication resistance in a clinical setting. And then there's all these other things that can happen with it. Viral subtype, country of origin. So I think Francois highlighted that one of the things that a lot of these studies are really interested in highlighting is country of origin of infection. So there's lots of studies, for example, in Europe, one pretty egregious study in my regard, looking at how HIV infections are coming into Greece and Athens are being driven by people from North Africa. And it doesn't acknowledge the context of xenophobia, racism, social context of intensified HIV criminalization in that country, and just highlights this origin of infection from somewhere else. Timing of transmission, and then getting into the notion of directionality and direction, which I think Francois touched on already, which can be quite problematic. The direction of transmission, who directly transmitted HIV to who, is still sketchy scientifically. There's a lot of debate around it, but people are trying to actively do it. And so just really quickly, and I think Francois also highlighted this, but one of the things that's kind of blurry and an issue here is we're getting at a context where research and public health surveillance are being deeply intertwined with each other. However, both of those fields operate with different forms of ethics and a different logic and intention to ethics. And public health ethics is all about moving forward with the public good or public benefit, which results in evacuating people's individual right to consent. And so when we, for example, are collecting data about people in a routinized way where we're not asking for consent and then sharing that data with researchers to do work on it, there's ethical concerns there, which is why, for example, that NIH study ended. Researchers may end up getting data sets from public health authorities that have been collected without consent, will then do research on it, doing all of their genetic analysis to determine things, and then publish that in a journal. And people living with HIV whose blood was used in for that study will have never consented or not even know that their information is in a journal. Those researchers will then share that data set online in a GenBank or in a public database where they can be searched for. So all of us who have been in a cohort study could be, our genetic sequences could be online without our knowledge. They can be studied over and over and over again by other researchers. And so this blurring between the boundaries is something that we're trying to call attention to get some clarity on and kind of get researchers to consider the implications of this. And so just two specific studies that I just want to highlight. And whoever is taking timing me should just let me know when to stop talking because I'm just going to keep going otherwise. Okay. So I think Francois mentioned Poon here, and this is one of the kind of leading studies that outlined this approach, which is from the BC Center for Excellence. This study, just really quickly, just highlights the kind of the intertwining of public health intervention and research. So it's published in the Lancet, but it's an intervention into gay men having and men who are having sex with men who are drug users. And I won't get into all of this, but this highlights how the system works, that they collect data on, and how all of our samples are entered into this kind of AI system that documents and makes calculations about us and identifies clusters. But the thing to note is that this is kind of proposed as research, but also as an intervention, and there's kind of a intertwining of the two things. And consent wasn't taken for these samples to be used because it's in BC, as we note, it's a routinized system. This one in BC, also kind of obsessed with origins and doesn't acknowledge the social context of xenophobia in this province and criminalization, obsessed with kind of this origin focus, identifies that Haitians are primarily driving infections in the province. And here you can see that consent was waived by the researchers, not by people living with HIV. We don't know what they would say about this study, and that data is available online forever in GenBank. Our genetic sequences are there for people to review on an ongoing basis. In regards to, I only have a few more minutes, but I just want to touch on two things. Is that this was another study done in, this is a response to another study that was done, that was published in The Lancet on looking at genetic sequences and surveillance for trans women in LA. And a group of researchers and people living with HIV, including myself, responded to the study, asking why they didn't ask for consent and concerns about criminalization in that context, and also the outcomes of the study. One of the things that we're questioning about the use of this data is that there's limited benefits for community. This study that was done on trans women in LA, which was widely kind of disseminated, the main finding of the study was that trans women sleep with straight men. And so if you know a trans woman who's straight, yes, they're gonna sleep with straight men. That was the main finding of this study. And so for community concerns about the benefits of this study, what was the benefit? People in community already know that. And so we tried to highlight that in this and called attention to it. And our response was published in The Lancet. The researchers responded to us and said that surveillance for numerous infectious agents, including HIV, is done ethically and without consent. The public good of HIV surveillance justifies this approach. Now here the implication is that people living with HIV are not part of the public and that violations against our rights are justified for some ideological conception of the public, and we counter that idea. Just one thing to note, that there was a study done looking at whether people living with HIV would consent, having robust understanding of what happens to their data in genetic sequencing studies, and only 50% said they would consent. This one study done in the US. And fears around consenting were loss of privacy and confidentiality, lack of interest, and unwilling to share their HIV status with others. But one of the things that these studies need to do is get a big picture as much as possible in order to they want to capture everybody. So the idea of asking for consent is contentious, but here we see that people living with HIV 50% of the time will not consent. Finally, just to power through, I just wanted to highlight one quick thing. Oh, yep, is this study done, which Francois's definition of molecular surveillance is from. We did a global review of the human rights implications of these studies, examined, I was tasked with taking on this report and looked at around 90 different studies around the world, looking for concerns or like looking at how they engage with issues of consent, criminalization. And we came up with a range of recommendations, which are to take the concerns of people living with HIV seriously, to respect our bodily autonomy, that there must be a clear and demonstrated benefit that outweighs the potential harms of MHS by ensuring protections, and the demonstrated benefits of MHS must measurably include people living with HIV. So we have to have a clear benefit that's we're consulted on. Providers ordering HIV sequences must inform people living with HIV about how their blood and data is being used. And there should be an opt-out process in relation to consent. And that implementers of MHS should publicly advocate against punitive and coercive laws. Just two quick things I'm gonna just wanted to highlight to you so you can all see, because I think you would be interested in this. Diana Tordoff and Joshua Hairbeck, who are molecular surveillance researchers, have been very proactive in engaging with community, and they wrote an article about their study, which they halted in Washington State because of our concerns. and they've written a paper about lessons learned from community engagement about phylogenetic research and molecular surveillance data with a number of people living with HIV. A very interesting paper about responding to these concerns. And one other quick thing to note, I mentioned this already, but the PACHA resolution from the US, which just happened in October, which has called for states to require language notifications for all people living with HIV if surveillance is being done in this way, and that there should be a clear opt-out process for that to happen. And I know I'm over time already, but I just wanted to highlight one more thing in terms of social context, which is ongoing criminalization in Canada. We are in a process of things being in flux and in reform. And one of the concerns from community is that as a result of reforms in relation to criminal legal processes, there could be intensified action on behalf of public health authorities. And so I just wanted to highlight these two cases. One specifically is, about viral load information being shared with police. We know that public health authorities actively work with police in certain instances when certain people living with HIV are considered risky or recalcitrant in terms of their treatment. And so here we have viral load information at the very bottom. You can't see it there of this press release about someone who was facing charges of aggravated sexual assault. Those charges were dropped, but their name and viral load information were published by police, which was garnered from public health authorities. And then people from BC might be aware of this case from 2019, where there was an active manhunt against a man because he was considered virally infectious, and police and public health worked together with the media to go after that man in a manhunt. And publicized his viral load status and everything in the media. So this is these are both from a few years ago. So you can see that the concerns that community have about the ways in which this data could be used are very real. I'll leave it at that, and happy to talk with anyone else or anyone about this at any time. Please check out our molecular surveillance report. It goes over the science and all of the things I've just talked about. And thank you again for having me.